It's a Friday morning. Sean and Sue at the beautiful Pacifico patio, powered by RWJBarnabas Health. And joining us right now, speaking of RWJBarnabas Health, we're joined by Dr. Nisarg Mehta, who's MD, general surgeon at Community Medical Center, to talk about the topic of GERD. And if you're saying to yourself, what is that? Well, we're going to find out. Doctor, thanks for joining us.
Hi, Doctor.
Hey, thank you. Thank you for having me.
Good morning. All right, what is GERD and what are some symptoms people should look for? It's something I never really heard of, Doctor.
So GERD is a very loosely used term. What it means is, or what it stands for, is gastroesophageal reflux disease. Esophagus is the first part of our GI tract, followed by the organ known as stomach. And stomach is where the digestive process starts, whereas the esophagus is our food pipe. After eating the food or after chewing the food, our tongue pushes it into the upper esophagus, and that goes down into the stomach for start the digestive process. What gastroesophageal reflux disease means is the contents in the stomach, which are mainly the gastric and intestinal content, should never be going up into the esophagus. The reason for that is, anatomically, there is a valve which divides the esophagus and the stomach boundary. That valve is called the lower esophageal sphincter. It is a valve which is at the end of the esophagus, and this valve relaxes every time we eat food. Every time the stomach is about to receive food, that valve relaxes, and we can think of it as a door opening so that things can enter into the stomach. The door closes, and the valve closes. Whenever that valve is not working well, unfortunately, it remains open. And what that does is the contents from the stomach, which is acid, which is produced in the stomach, and the intestinal contents have an easier way to come up into the esophagus. Now, our esophagus is not very well equipped to handle these fluids. These are foreign things for the esophagus. Hence, say, gastroesophageal reflux disease. And when things come up into the esophagus, we term it as reflux. When we talk about reflux, we think of it as only acidic contents coming up into the esophagus. And that is a big myth, because it's not just the acidic contents, but it's also the basic intestinal contents which come up along with it. And hence, not all the medications on the market these days, which we see, would be able to take care of the reflux completely. They may take care of the acidic reflux till a certain extent, but there is other type of reflux, which is the intestinal fluid reflux, which these medications don't really take care of.
Doctor, what are the risks associated with long-term GERD?
Just as I mentioned before, that the esophagus is not very well equipped to handle the reflux disease or any kind of reflux contents coming from the side of the stomach. Now, whenever these things come up, whenever these foreign material comes up into the esophagus, it leads to inflammatory changes lining the wall of these. Because the cells the esophagus is made out of or is lined with are not very well equipped to handle this fluid content. The cells which the stomach is lined with are very well equipped for this to handle this kind of acid, and they have a protective mechanism, whereas the esophagus doesn't. Hence, it leads to any kind of inflammatory changes. The early precancerous lesions, which we see after these inflammatory changes, is called as Barrett's esophagus. Barrett's esophagus is a way of esophageal wall trying to protect itself from the foreign stuff coming its way. In theory, it's a good thing. However, it creates a lot of commotion on the cellular level, and this can eventually lead to formation of any kind of cancer in the esophagus. Patients with Barrett's disease almost have a 40 times risk of developing esophageal cancer than any other normal person. And this is why taking care of reflux disease in its early stages is very, very important.
What are some of the treatment options, doctor, for GERD?
The treatment options initially start with medical management, and medical management includes taking medications which are either antihistaminic drugs in terms of Pepcid or drugs like Pepcid, and then the next level of drugs are any kind of acid suppression medications, like commonly which we find in the market in terms of omeprazole or pantoprazole. However, as I mentioned before, that the main issue of reflux disease is the valve, which is the boundary between the esophagus and the stomach. And the ultimate treatment option for any kind of reflux disease eventually is to fix that valve. Unfortunately, there is no medication out there right now which is able to fix the valve itself, which is the culprit in most cases. Hence, eventually, we have to resort to an operation or a surgery. Now, in today's day and age, with technology growing, we have laparoscopic and robotic surgery, as well as advanced endoscopic options. Fixing the valve, and in certain patients who have a hiatal hernia, where a portion of the stomach or the distal end of the esophagus sneaks up into the chest, their valves are not working well either. And these are the patients who become very good candidates for a surgical treatment option.
What about the swallowing difficulties, doctor?
So esophagus is lined up with a variety of nerves. And the way esophagus works is in a propulsive movement. The job of the esophagus is to push the food through from one end, which is the mouth, to the other end, which is the stomach. It is either that the nerves of the esophagus itself are not working very well, which could lead to any kind of swallowing issue, or it is the blockage of the esophagus at certain points, which could lead to issues in swallowing. And that's why this could range, that the disease process could range anywhere from benign disease such as severe esophagitis because of reflux disease to achalasia, where the end muscle is not opening at all, the lower esophageal sphincter is not opening at all to have the food enter in stomach, or patient having a tumor in the esophagus which would be blocking any kind of food going through into the stomach. And this is why any kind of swallowing difficulty or the feeling of something getting stuck in the back of your throat needs to be taken very, very seriously, because diagnosis is eventually the key in identifying any kind of issue and then treating the issue appropriately.
For more information, go to their website at rwjbh.org/community for more information. Dr. Mehta, thank you.
Thank you.
Thank you.